and I'm just gonna be taking a bite registration. This is so that we can see the proper way your teeth come together. So before we start, I'm going to ask you to open and close, open and close, open. Oh, no, I don't want you to bite like that. I want you to bite just on your back teeth. So they'll often do all types of weird things, and all of a sudden they'll bite edge to edge with their front teeth. They'll like all of a sudden swing their jaw to one side. Tell them just to bite in their normal bite on their back teeth. So open and close. Once you are making sure that they're biting in their normal bite and they're not doing anything funky, you can get ready to actually do the bite impression. Okay? Now, you're going to take the extruder gun, and you want to, before you go into their mouth, give it a couple of squeezes so that the material starts to go and mix in the tip. Otherwise, they're going to hear all that clicking in their head, which doesn't sound very loud out here, but when it's in your mouth, it sounds pretty loud. So you're going to get it mixing here, okay? You're going to retract. It doesn't matter which side you start on, the left or the right, you're just going to start on one. I'm going to squeeze, I'm going to actually pull his cheeks back so that way you guys can see a little bit better. Just for the demo. So I'm going to retract the cheek. I'm going to start squeezing. You do need to squeeze with kind of some good pressure, and you want to go nice and slow all the way until it stops. So I have to now release and squeeze again. So you need a good amount of material there to get a good impression, and now I go all the way to the midline. I'm going to go to the most posterior again. And then just make sure where you cross over that you have enough. So the occlusals and the incisal edges should be completely covered on the mandible, okay? Then I'm going to ask my patient to bite down in their normal bite, and they're just going to stay biting. So I wouldn't obviously need to hold them shut, they'd be able to hold themselves shut, but we're going to ask them to stay in their normal bite. Oh my God. We're here. We're here.
And they don't have to bite down hard, right?
No, I mean fairly firm, but not like you don't want them to bite all the way through it yet. It's weird, huh?
It happens every time I'm by myself. I know I'll walk by sometimes and I'll see you in the dark. I'm like, why is she in the dark? It's great. I love it.
So this set's fairly quick. It's already pretty much almost set. Give it another second or so for good measure. You can let the patient into this has like no odor, no taste, right? That's one of some of the advantages of the elastomeric material. What's a disadvantage with polysulfides? They stink like sulfur, right? All right, so then we're going to ask the patient just to open, and they might have a little bit of resistance when they open, and you'll take that out, and now you have your bite. So that when you pour up your models, or not when you pour up, but when you trim your models now, you're going to use this. So you're not guessing what their bite is, you have an actual impression to be able to articulate their actual bite, okay? I'm going to take this. I would rinse it in the sink just like I would my impressions. I'm going to open my bag. I'm going to put that in. Glove off. That doesn't need to be wrapped in a wet paper towel, right? The elastomeric. So I'm just going to disinfect it and seal this up. Okay? Now before I pour, what am I going to need to do for these?
Rinse them.
You want to rinse them, right, and get that disinfectant out of there. Tap them off, and if you need to, you could even use the air water syringe to get some of the air out of there. If you leave water in there when you pour it, what are you going to get? You're going to have bubbles and voids in your impression, so make sure it's really dry, okay? I don't think do you need a demo on the pouring? I think you guys have done enough pouring that you're probably good.